Well, Dr. Liz O'Riordan was a leading breast cancer surgeon when at the age of just 40, she heard the words she had delivered to countless patients: "You have cancer." A stage 3 diagnosis and 2 recurrences followed. And ultimately, she stepped away from the career that she loved. She's built a platform with more than 200,000 followers worldwide devoted to cutting through the online noise about cancer and redefining how we talk about it. Earlier today on The Noon, Bianca spoke to Dr. O'Riordan about her new book, The Cancer Roadmap.
Wait, so first of all, the fact that you were an award-winning cancer surgeon, so revered, but you missed the own signs of you going through something. What were those signs, and why did you not pay attention to them?
Like most women and men watching, I never checked my breasts. I never thought I'd get breast cancer. I never thought it would happen to me. And then one day, age 40, I stepped out of the shower and I noticed a lump in my left cleavage. And I just thought it was a breast cyst. I wasn't worried. I had a mammogram that was normal, and then I had an ultrasound, and I turned to look at the screen, and I saw a cancer. And it was like a light bulb just went off.
And this is something that you're used to doing, to telling people these same words. So when you said a light bulb went off, what were the emotions that you were feeling when you heard those words?
It's fear. It can't be happening. It's ironic. It's my job. I can't have breast cancer. But because I've looked after women younger than me who've died, I knew too much. And it was really scary to go through every single treatment that my patients went through and find out what it was really like, and would I still be alive in 10 years?
That's pretty fascinating, to go through all the things that you've talked your patients through. What was the one thing that you realized, this was a lot harder than I thought?
I think there were 2. One was chemo. I had no idea how bad chemo was, how awful it can make you feel. You lose everything, your pride, your dignity, your hair. It was tough. And I was a 40-year-old triathlete. How the hell am I giving it to my 70-year-old ladies? But making a decision to have a breast reconstruction, because you don't know what your breasts mean to you until you're faced with losing one. And I did it for vanity, and I felt guilty. The vanity was the reason for having an implant.
When you talk about writing this book, why did you want to put this all together? Because when we talk about these rising cases and diagnosis of cancer among women, there's so much information out there. A lot of some of them crazy, some of them true, some of them I don't know if they're factual. But why did you put this together?
I think in the last 2 or 3 years, the rise of misinformation has grown hugely on social media, on TikTok, on podcasts. People don't know who to believe. And doctors aren't online telling you common sense because we're just too busy working. And people are dying because they are believing misinformation. We had a girl in the UK who died age 30 following a juicing diet for lymphoma. People are going to clinics in Mexico and dying, and I just want to get common sense out there. Cancer is going to happen to a lot of us. There are things we can do to reduce the risk, but no one can promise you a cure. And if I can help people understand what's real and what isn't, and actually give them something to take control of, then the world will be a better place.
I see the desperation for people trying to find alternative therapies. Because when you go through Western medicine and you see so many doctors and you're saying, just do this, and if it's not getting better, doctors are slammed with patients over patients. So I understand people trying to put matters into their own hands. Is there things out there that you see promising that may be working in terms of alternative medicine?
I think alternative medicine on its own doesn't cure patients. Cancer patients die, but as a complementary therapy, we know that eating a lot of fruit and veg and exercising, some supplements and mindful techniques make you feel better. And if you feel better, you're going to look after yourself more and give mainstream medicine a better chance of working.
In terms of this book coming out, I know it's going to be a big help for people. Where can people find it?
It's available in all online and in-store bookshops from the 4th of November.
And for anyone that is battling this disease at this current moment, any words of advice you'd like to give them?
You're not alone. And I get that you're scared and vulnerable and you're looking for hope, but honestly, trust your doctors, read the book, and just think before you act on what you see on TikTok.
All right, good information. Well, stay with us because the news block will be right back.